Hi, I'm Brian Young, and today I'm here with Dr. Terry Shirvani, who started the Savvy Supplement Consumer. Hi, Dr. Shirvani.
Hey there, Brian. How are you doing today?
I'm doing well. And Dr. Shirvani, this is actually your show, and I'm here to ask questions and represent the consuming public, which is a really interesting format, and I'm happy to do that with you. So, what we want to do right here at the beginning is just talk about the basics. I know you've worked inside the dietary supplement industry for nearly 25 years. Starting your career as an R&D scientist and product developer. Could you please tell us more about your background and what inspired you to start this YouTube channel for the Savvy Supplement Consumer?
Okay. Well, that's a great introduction and great way to start. Let me ask. I'm going to answer the second part first,
Okay.
because this is a mission and passion for me. So I have a huge commitment to really raising the bar for quality in the dietary supplement space. Look, there's a lot of great things happening in the supplement space. It's really booming. It's
Yeah.
great. It provides a lot of products for all different kinds of purposes. So there's a lot of good there. But there's also, from my perspective, having been inside the industry for a long time, there are a lot of breakdowns in quality that I see. And I have very high standards. I will admit that. Okay. But nonetheless, from my perspective, the consumer is going to drive quality in the supplement space, consumer demand. And how I see that as a function of being educated. And I'm calling it being savvy. Being a savvy supplement consumer is going to drive quality in the supplement space. When people realize or are more educated about how to read labels, how to recognize a quality product from a product that's of lower quality, when we can see that more clearly, they're going to be more demanding around that kind of thing. So, and I don't see that happening from the inside of the industry right now. In fact, if anything, I think we're regressing.
Mm.
So, and that's really just, I think, partly a function of having a flood of new brands into the space in the last few years. And in fact, the supplement space has been growing so fast in the last several years, or even the last 10 years, that it's outstripping the ability of regulators to keep up. Okay,
Mm.
so when you don't have good regulation, when you have regulations that aren't really enforced as well as they could be, you can have a lot of breakdowns in quality. This is kind of human nature. So you have, more smarter consumers making smarter choices and driving quality. Okay, so that's
Okay.
kind of it. And so what we're going to be doing here is we're going to be talking about all kinds of topics. But in the beginning here, this is our first video. Yay! And
Yeah.
so what I want to do today is establish sort of an overview of the supplement industry. Just a basic kind of look at it. And then and of course establish that there is a regulatory framework, which I
Yes.
think really needs to be established, in the public's mind,
Because
right?
most of us don't understand how it
Right.
works.
Yes, and look, even people on the inside, some people don't. And I've seen that a lot, right? So yeah, so we're going to establish that, and I'm going to give some, talk about some basic principles, and one really good principle. Call it a tip or a hint for people when they're, especially shopping online, and so they can sort of recognize a good product and kind of distinguish that from a product that might not be so good.
Okay.
Okay?
So great. So then
Yeah.
let me ask you this. I think it'd be really helpful if you could give us a basic overview of the dietary supplement industry and then explain how this manufacturing, this contract
Yeah.
manufacturing fits into the picture. So what
Yeah.
do we need to know just to
Yeah.
even get started? Where do we start?
Yeah. Well, first, yes. Well, first, and this is my fault because I talked a lot there. I'm going to talk about my background, and then we'll go to that
Okay.
question. So, yeah. So I'm a naturopathic physician, and I graduated in 1995 from the National College of Naturopathic Medicine. That is now the National University of Naturopathic Medicine. So, I was way back in my teens and in my early adulthood. I was a professional musician, and I actually went to music school in Hollywood, and I was on the track to be a studio musician. And then I had a very kind of profound epiphany in my life, and I went back to college, and I became pre-med. And I was just following sort of the guidance that I had at the time to get back to school and go to medical school.
Okay.
So, I'm kind of like, wait a minute, I'm a drummer, not a doctor. But anyhow, something said, go back to school. So I did. And I got married when I was actually in college. And I moved to Columbia, Missouri to go to school there at Mizzou. And my wife was in a PhD program, and we decided as a couple that one of us had to go to work to pay the bills. So,
Right.
we just weren't quite making ends meet. So I stopped. I put my school on hold for a year, and I got a job, interestingly, at a natural food store in Jefferson City, Missouri. So I was
Hmm.
working at a mom and pop store in the middle, in this small, the capital of Missouri, in a very small town. And in that small town, between 10 a.m. and 4 p.m., nobody would come shop pretty much. So it was
Right.
shopping in the morning, shopping in the evening, and not a lot in the middle. So I spent almost the entire day either stocking shelves, taking inventory, learning every single product in the store, including a lot of supplements, because a big
Hmm.
portion of the store was supplements, reading labels, learning about all the legacy brands of today, like Rainbow Light and Solgar and Carlson and Nature's Way and all these amazing legacy brands, right?
Right.
And then reading every single book we had, because we had a big sort of big shelf of all kinds of books to read, on various topics of natural medicine and clinical nutrition. So I spent, a lot of time reading and, getting to know the supplement space, right? And I discovered naturopathic medicine there. That's how I discovered that
Hmm.
naturopathic medicine even existed, because I was getting ready to go to KU Med School. That's where I was headed. So once I learned about natural medicine, and I was a very health focused person at the time, I applied to medical school in Portland. I also went to visit the school in Seattle called Bastyr, and I chose to go to NCNM. So that's where I ended up.
Okay.
And while I was in school for 6 years, I really began to have sort of a vision of inventing products, because I'm a very creative. I'm a high creative as a musician and an artist. I'm very creative.
Sure, that makes
So
sense.
yeah, so I thought, how am I going to express my creativity? Well, I can invent products. And I didn't know much about the dietary supplement space, but boy, that was certainly a vision, because now of course I've spent the last almost 25 years being very immersed. So that vision came to fruition in 2000, in the 2000s, early 2000s, when I got my first job in the supplement space in Marcos, California, in the San Diego area. I was hired as an R&D scientist, and the
Okay.
rest is history.
Yeah, well, that's some history there, and you mentioned the number of companies that are out there. I noticed that I read the stat the other day. In 1994, I think they said there was about 4,000 products, and these days, depending which source you look at, they're like 90,000. So
Yeah,
that's
it's
another one of the reasons we're really looking forward to
exploding.
this program and having you help us understand how the whole world works. So you went to school, got your degree, you learned about R&D, but then how'd you transition from that to where you are today? And how did that prepare you for teaching us about regulation?
Well, so upon graduation, I was in practice for a while,
Okay.
and
As a
just
doctor.
yes, I was in practice as a naturopathic physician in like 2 or 3 states, and I just realized during those years, even though I loved supporting people with their health, it just really wasn't my passion, and so that's what led one thing to the other, to the job with the contract manufacturer in San Marcos. So, so let me get into a little bit about how the industry works. Having worked,
Okay.
so I've worked in contract manufacturing, which is basically a factory that makes supplements, right?
Hmm.
And I've also worked for brand owners who don't make their own products but market products, right? The
Okay.
the FDA calls those own label distributors. So I've worked for brand owners, I've worked for manufacturers, and I've also done some projects here and there for raw material suppliers. So those are the three basic groups or players in the industry on the product side. Brand owners, okay, who are mostly marketing people, and hopefully they have some science folks and some quality folks in their company. But a lot
Right.
of these folks are marketing is their focus, right? So they know how to get a label on a product and get it out there and sell it, okay? And then there are manufacturers. And so most of these manufacturers, we call them contract manufacturers. They make products for brand owners, okay? For
Okay.
the most part, brand owners don't make their own products. They hire or contract that out to a manufacturer. And most manufacturers don't have their own products, their own labels. They actually focus on making products for the brand owners. So that's usually how it is. But some brand owners do their own manufacturing. Okay,
Okay.
that's not as common, but there are. And then there are some manufacturers who have their own brands. I actually worked for one in Texas who had a practitioner line of products that they mainly marketed to chiropractors. So, whereas each of these two groups do cross over, they mostly do one or the other. Okay.
Okay.
And then there are raw material suppliers, and they provide the components, such as ingredients and packaging and whatnot, to the manufacturers who then use those components to make the supplements. Okay. So those are the three, kind of groups, right? Then there are the regulators, and the federal regulators are the FDA. We all know the FDA, and then of course the FTC. And the FDA, the FDA has established good manufacturing practices. Okay, so those are the regulations that manufacturers have to follow for public safety, right? For quality, and then of course the FTC, it regulates advertising, right? So anyhow, I can get a little more granular. Do you have another question, or should I keep going and get more granular there?
Well, you did mention a lot of groups. I guess I'm kind of curious about the regulators. I've heard that the dietary supplement industry isn't regulated. Is that true?
Yeah, I mean, first of all, absolutely not. It's not true. And it is a misconception that I've come across in various blog articles and, sometimes in videos. And it's kind of understandable for a couple of reasons, but no, of course not. The dietary supplement is absolutely regulated. And it is a little amazing that notion still exists today when everything you can Google on everything you ask on Google has an AI response, and AI should know that, right? So, but
Yeah.
anyhow, it's pretty easy to look up this stuff. But the FDA regulates the dietary supplement industry under something called the Dietary Supplement Health and Education Act, and that was enacted in 1994. We fondly call it DSHEA, okay? So although DSHEA has its controversies and so forth, it outlined the provisions for good manufacturing practices that are specific to supplements, right? So we have, so overall, supplements are regulated inside the realm of food, but for a long, long time, dietary supplements didn't have their own good manufacturing practices or regulations that govern quality. So, but today we do. So food has their own GMPs. We call them GMPs, good manufacturing practices. Dietary supplements have their own GMPs. That's 21 CFR Part 111. Okay, if you want to look it up, 21 CFR Part 111. And then, of course, the drug space has their own GMPs. That's 21 CFR Part 211. Okay.
Oh, wow.
So there are specific GMPs for dietary supplements. The problem isn't that we don't have, and if you go look at them, you'll see they go on and on. There are all these parts, okay, and so parts, subparts. So there are there's a lot of regulations for the supplement space. Some people complain there's too much regulation. From my perspective, we don't have enough. Okay, but at any rate, they do exist. But I think the main issue is enforcement. It's not that they're not there. It's that it's the enforcement side that's difficult. So because of the flood of brands into the dietary supplement space partly, and also because of the allotment of resources, the FDA is challenged in policing the space. Okay. It's a big challenge. All right. So we can leave it at that for now. We can talk about that more granularly later, but policing is a challenge. Okay. So it's not whether there are regulations, it's the enforcement of those regulations. Okay.
Okay.
And then the FTC regulates dietary supplement advertising and marketing claims made on products. And so that's their realm. Now, those two things do overlap because the FDA is responsible for labeling, right? So there are labeling regulations. And so they're very, very long and somewhat complicated. And so the labeling regulations also apply to websites and web copy and things like that. So the labels that are on the bottles, the FDA regulates those, and then those labeling regulations also apply to various other things that are said on websites and even in social media. Okay, if that makes
Hmm.
sense.
Yeah.
So one really important point here, and I think it's part of why people have this misconception about regulation, is that the FDA regulates supplements and drugs differently. So the FDA has to approve new drugs before they're marketed. It's called pre-market approval, right?
Okay.
So before new drugs are marketed to the public, the FDA has to approve those. But it's not the case with supplements, okay?
Hmm.
So the FDA does not have the authority to regulate supplements before they hit the market. They can only really take action, after they're already on the market. Now they can actually do something about it if they're in violation of some regulation. So
But that
that
means that, doesn't that mean that the consumers are potentially at risk because you don't know what's on the market till it shows up, and it's not like the FDA can run through and get to
That's
everybody all
right.
at once.
No, and they can't because there's so many different products on the market. So there's
Yeah.
part of the problem, right? And I think
Right.
maybe this misconception has something to do with the fact that the FDA doesn't approve supplements before they get to the market, right?
Hmm.
In other words, Brian, if you wanted to have your own line, simply you need the resources, you need formulas, and you need a manufacturer. And once you've got that together, you'll have your own supplements, and you can put them online or sell them however you want. I mean, you can sell them in different ways. So you could do that without really much background or experience. It is possible to do that. So
So, okay, so Dr. Shivani, if the FDA doesn't approve new dietary supplements before they go to market and the way they approve drugs, then how is the public protected in terms of safety or even fraud?
right. It's a really, really good question, and it's one of the main reasons why I started this channel. Okay, to make the public aware of how the industry works and how products get on the market, right? And
Hmm.
that it's very important not to blindly trust just any brand.
Yeah, I should
So
say.
yeah, it's amazing to me how people buy products without knowing very much about the brand. I get texts and emails and calls from friends and family and people saying, "Hey, could you give me some advice about these products I'm considering buying?" And I look at them sometimes and think, well, why are you even considering these products? They don't. I just wouldn't buy any of those, right? So
Right.
oftentimes they're shopping somewhere, they're sticking things in their cart. Oh, that looks good. I'll take that. And I'm not. So I'm like, don't do that. Don't do that necessarily, right? Do some background research and know kind of what you're buying, and certainly know how to read a label because reading labels is very, very important when you
Well,
buy
that's a
supplements. It's
that's a
very
whole nother
important.
skill set, isn't it?
Yeah, and yes, and we're gonna have some tutorials on how to do that. Try to keep things interesting and not too dry because it can get a little dry. But yes, we'll have some basic pointers on how to read labels. And the most important part of the label you need to learn how to read is the supplement facts panel. And that's the panel to the right of the marketing panel, which is what's in the front, right? That's called the
Yes.
marketing panel or the principal display panel, right? So anyway, the bottom line is brand trust. That's the bottom line. The brand
Okay.
is key because the brand has control of the manufacturing. Okay,
Is that
and
why, is that like if I go to, I've been to a few naturopaths over the years, and I noticed they seem to carry a couple, three, four brands almost consistently. Is that what you're talking about? Because they're just established for being good quality brands who have been researched, and every time they get
yes,
looked at, they're the real deal.
hopefully,
Hopefully.
yes, hopefully. Look, some physicians are pretty savvy about supplements, and some aren't. And it does depend on their degree, their background, their training. Naturopathic physicians should be more savvy. They aren't always. Okay, I've met MDs, medical doctors, who are quite savvy about supplements. I've met DOs, doctors of osteopathy, who are quite savvy. So, and chiropractors. So I've met, it kind of depends on the focus of the physician. So, but anyhow, look, and we'll get into this in more detail later, but the practitioner channel is a marketing channel for supplements, and it's a specific thing. So those products are supposed to be for licensed healthcare practitioners only. It doesn't
Okay.
always work that way. There are some overlaps with retail, okay, and we won't get into those details today, but we can talk about it another time. But just suffice it to say that the practitioner channel should be a higher quality type of supplement. Okay, and
Okay.
practitioners should be selling practitioner supplements. Now, they
That
don't,
makes
I
sense.
don't know that they always do, right? But that's really what should be happening, right? So,
Hmm.
theoretically, you're getting a better quality supplement from a practitioner. Okay, theoretically. Anyhow, but the bottom line is brand trust. It's the whole deal.
So that's really interesting about the brands, Dr. Shivani. I guess what I want to know more about is how does a supplement consumer know which brands to trust? Because if it comes down to the brands, I've got to know which brands are good. That's its whole can of worms, right?
Yeah.
How do I find out which brands I can trust?
Yeah, look, that's a great question and a big topic, one we're going to cover over this series of videos. So, like I said, there are rules of thumb, sort of basic principles to guide you in terms of quality, and I'm going to share that as we go through, right? So, these will help you sort of recognize the red flags that should alert you to, I don't know, potential fraud, even safety concerns, right? Help you distinguish between a good product and one that may not be what it says it is, right?
Hmm.
So, here's my first tip on how to spot a quality brand versus one that is of lower quality or even fraudulent. Okay, so if you're
Okay.
shopping, this is for online shopping. If you're shopping for a supplement online, right? And
Okay.
you may be on, it may be a direct to consumer product, it may be on Amazon. If a product has its own website, I would go there versus Amazon because often you won't find the same sort of those are thumbnails on the left side. You won't see the same kind of information disclosed sometimes on Amazon. So if a brand has its own website, I would go there. But if you're on a website looking at a product from a brand and you
Hmm.
cannot find the supplement facts panel within, I'm going to be very generous here, within 60 seconds, okay? That's a
Okay.
long time in my world, okay? You really should be able to find the supplement facts panel, and that's what it says, supplement facts across it, and it's on the right side of the bottle. There are three
Okay.
panels, the left, the middle, and the right. It's generally on the right panel, so you turn the bottle to the right. Anyway, when you're shopping online, you should be able to find that very, very quickly, right? If not immediately, within, and I'm going to again be generous, within a minute. And if you cannot find the supplement facts panel, I'm not saying a list of ingredients or talking about what's in there. Oh, we have ginkgo, and oh, look at we have ashwagandha. You know, that's marketing information. You want to be able to see what's in the product that's on the supplement facts panel that's regulated by the FDA, okay? The label, every single portion of that label is regulated, okay?
Hmm.
There are lengthy labeling laws that regulate that whole label. So you want to be able to see the regulated part, not the marketing stuff, but the regulated part. So you can read actually what's in the product so you're aware. And if you can't find that, and I'm not even going into detail on that. That's something for later. If you can't find it within a minute, that brand is not being transparent. And I would not buy anything from that brand. That's what I recommend. Just go to
Okay.
some other brand. Buy from brands who are willingly upfront and transparent about what's in the product from and what's in on the supplement facts, right? Because that's
Yeah.
where information has to be disclosed that is in the law, right? And obviously you should read whatever they have on their website about the product, that's fine. But if you can't find the supplement facts panel within a minute, then just go shop elsewhere. That's my
Right.
that's my recommendation. And that's a simple thing. Very simple.
Okay.
Simple rule of thumb.
Yeah, well, that makes a lot of sense. I've seen plenty of websites that had lots of verbiage and lots of pictures and all the clips, but I know what you're talking about. I'm like, well, what's in the bottle? Like, how
Yeah.
many micrograms or this or
What's
that? It's
actually,
tell me,
that's
what
right.
am
The
I going to put in my
dosage.
body?
That's right. You want to know the dosage. You want to see what's in there. And look, you may not know the difference between a botanical extract and a botanical powder, and you may not, you may not have technical information about raw materials or ingredients, but I'm just giving you this as a tip and a rule of thumb. When it comes to understanding that information, that's how what we're gonna have an educational series on that, on how to understand some of that information on the label, right? Not
Yes.
not and look, it takes many years to learn a lot of this stuff, but so I'm going to give you rules of thumb and tips, principles. Not this isn't going to be putting you to sleep, right? This is going to be stuff you can
Sure.
use that's easy to use or relatively easy. But for now, this is a very broad thing. Just don't buy a product if the brand won't be transparent with the label,
Yeah.
right?
No,
And if you're
that
shopping
makes total sense.
online, you can't actually pick the bottle up. If you're in Whole Foods, right,
Yeah.
or a store, you can just pick the bottle up and you can see the label. But when you're online, obviously, that's something that the brand owner has to be willing or has to disclose to you. And if they don't, that's not a good sign.
Yeah. Well, I just like to thank you again for putting on this series because I'm among those, like I said, who have at times felt vulnerable, trying to do the best I can with what I can find out. And I feel like you're just kind of a godsend. So I really do appreciate that. I thought maybe we could just finish up by telling us one more time, Dr. Shirvani, why did you want to do this? You've got all this knowledge in your head, but what's motivating you? Why are you doing this?
Yeah, look, I'm a consumer advocate at heart. Um, when I took my naturopathic oath, it really, really changed. There was a transformation that happened. Just I took it very seriously. I took the oath that I took to serve the public and public health very, very seriously, and I adhere to that oath in my work. So, and I see breakdowns in quality every day, and it's concerning. It concerns me, right? And so I simply want to provide some education and some information for the public to become more educated, more aware, and just be a savvier shopper. And
Yes.
and then that from my perspective drives quality. But the focus is on people getting what they're paying for and people being able to transform their health. Supplements there are so many really, really good supplements out there. But there are so many supplements, period. It's almost like a needle in a haystack in a kind of a way, you know what I mean?
Yeah. What,
So
90,000, 5 or 6 years
yes,
ago?
it's incredible. So, and look, quality is the bottom line. If the product you buy won't be of quality and may not help you much, or if at all,
Yeah.
unless the ingredients that went into it were quality ingredients. And that is something I've seen as a big breakdown over the years. And we'll talk more about that later, but I see a lot of very cheap ingredients going into products, and you put cheap products in, you don't get a quality product on the other side. So
Yes.
I just want to be shine the light, I'm an industry insider. Shine the light, not pointing fingers at anyone, just shining the light. Hey, look, here's some things you should know. Here's some things you should be aware of. Look, the supplement space, drugs can be very, there's a lot of serious adverse events that happen with drugs every year. There are not nearly so many with supplements. So we're not talking about, you know, lethal. We're talking about quality. In other words, getting what you're paying for and having a supplement be efficacious, having, it works for you, right? And that what you see on the label is actually in the bottle. Okay, those are the things I'm talking about, not
Mm.
whether it's going to really harm you or something. Supplements, for the most part, are not harmful, right? For the most part, can they be? Yes. Breakdowns in manufacturing, you can have harmful supplements, but for the most part, that's not the case, right? Supplements are relatively quite safe, but quality is a whole nother thing. Okay.
Yeah, does it work? I'm actually
Yeah,
going to do some
quality
good
and
for me.
efficacy. And look, safety can be a problem, so I'll be giving some pointers on that. But in general, that's not that's not the problem. The problem that I'm seeing, or the issue I'm seeing, is really efficacy and really quality.
Okay.
Okay?
Well, for our listeners out there, thank you for joining us. As you are, I am looking forward to learning more about how to be a savvy supplement consumer and take better care of myself. And we're very thankful to have Dr. Terry Shivani, who's going to help us do that. So we'll see you right back here next time on our next show with the Savvy Supplement Consumer.